Periodontal pathogen Fusobacterium nucleatum promotes chemoresistance to colorectal cancer. Colorectal cancer (CRC) is the most common gastrointestinal cancer as well as the third leading cancer by incidence and mortality in the United States. Research by Yu demonstrated F. nucleatum plays a critical role in mediating CRC chemoresistance. The purpose of chemotherapy is to shrink tumors and inhibit metastasis. However, chemotherapy failure was found to be the major cause of recurrence and poor prognosis in colorectal cancer patients. Fusobacterium nucleatum, F. nucleatum, is a common gram-negative anaerobe bacterium that is highly associated with diseases of the oral cavity. This bacterium was also found to be linked with the promotion and development of CRC. Kim states, periodontal pathogens or their toxins might enter the blood and increase systemic inflammation, which have a critical role in gastrointestinal carcinogenesis. When the intestinal balance is damaged, there can be incidents of inflammatory bowel diseases and colorectal neoplasms. Our research indicates that F. nucleatum is pathologically and clinically associated with cancer recurrence and patient outcome. F. nucleatum acts by attaching and invading human epithelial and endothelial cells. Methods for detecting F. nucleatum in colorectal cancer patients include frozen tissue, formalin-fixed paraffin-embedded tissue, genomic DNA, and feces samples of patients. However, the use of frozen and FFPE tissue specimens are limited by surgery or colonoscopy, and specimens from feces of patients often result in high false positive detection rates. Shang and Liu states the levels of F. nucleatum are significantly elevated in tumor tissue and stool specimens of colorectal cancer patients relative to those in a normal control. Research by Mima states the amount of F. nucleatum in colorectal cancer tissue is associated with shorter survival and may potentially serve as a prognostic biomarker. A recent study reported by Zhang proposes that F. nucleatum can mediate chemoresistance by autophagy pathway activation in CRC. It was also found that F. nucleatum can migrate with CRC cells to metastatic sites. Therefore, it is inferred that F. nucleatum is a part of a metastatic tumor that plays a role in the chemoresistance and contributes to disease recurrence. Another factor that has been shown to potentiate the progression of colorectal cancer is inhibiting the immune cell activity. Shang and Liu have confirmed that F. nucleatum produces a tumor immunosuppressive environment that promotes the progression and development of CRC. Furthermore, there was an enrichment of F. nucleatum in CRC tissues compared with adjacent normal tissues in both recurrence and non-recurrence groups. The high amount of F. nucleatum may potentially promote CRC chemoresistance. F. nucleatum orchestrates a molecular network of the toll-like receptors, microRNAs, and autophagy to clinically, biologically, and mechanistically control colorectal cancer chemoresistance. Research by Yu shows measuring and targeting F. nucleatum and its associated pathway will yield valuable insight into clinical management and may improve CRC patient outcomes. However, more evidence is needed to confirm causality and inform future detection and therapeutic efforts targeting F. nucleatum and other microbiota involved in CRC. Mohamed Haravi showed a history of periodontal disease with bone loss was not associated with CRC risk, although moderate to severe periodontal disease was a significant risk factor for CRC. Our research and references are as followed.